already going, man. Welcome to the Cyberland, the hellscape, heavenscape, known as Alt Psych Show. How are you, Dr. Hart?
I'm doing well today. Super excited for our topic and get to chat about some therapeutic devices.
Yeah, when we were talking about the show, it made me think there's really not a good place where people can learn about all the tools, specifically tools, because there were so many of them that are available to them, as a patient, or to us as providers, things that we use in our practice, we don't have experience with, or we don't know about, or maybe it's up and coming. So this was kind of a cool little topic to put together. Little extra work, but it was good to summarize things. So I was thinking, let's tell people about some devices, what they are, just crucially how they're used, and then I want to really have us both pick three that we find to be our favorites, and maybe as to why. So let's get to it.
I'm super on board. Let's ride.
So you find you use a lot of devices in your practice, yay, nay?
Oh yeah, we like to make sure that we're up to date on the latest technology, especially, even sometimes it's a patient brings you an idea and they say, hey, have you heard about this? So-and-so's had good results. And so if it does look like it's legit, and we bring it in and test it, and we'll bring it on board. So we keep a whole therapy department in the back half of the building for patients to run through different therapies that have been proven useful.
Yeah, and that's one of the things that always impresses me about you is your knowledge of the latest and kind of the greatest, and just the variety of devices that you know about and that you've used. Because coming from my background, there really aren't too many devices that are used. We might have had ECT, going back really since electricity was invented. We might have had like TMS, transcranial magnetic stimulation. Those are sort of the few devices bread and butter psychiatrists even know about, much less they may or may not even use. Most psychiatrists don't use ECT or TMS. So the integrated health world has a lot more supportive tools to uncover problems in physiology, biology, biochemistry, bioenergetics that I think are super cool and exciting. And we're going to kind of summarize today to get people an idea of how many options there are out there and what you use and to why. So one of the first ones I want to ask you about is something called CRT, which tell me what CRT stands for.
Yeah, CRT is computer regulated thermography. The quick and dirty version of that is it's a way you can take temperature to get a whole body picture of the regulation of all the different organs, glands, general body systems. And so we can dive into that one because that's a biggie for me a little bit later, but that's the quick and dirty. It's scan the temperatures, figure out what the body's doing.
And that actually has applications in traditional Western medicine as well. So that one's not as obscure, eclectic, or unknown about. Here's another one. How about the Rife Machine? What is a Rife Machine?
Rife Machine's a frequency-based setup from Royal Rife that you can use for both biofeedback to scan the body and as a frequency-based electromagnetic treatment setup and laser. So that's a really good device for treating things on your own too, either in the office or if somebody wants to buy one.
Is that similar to my next one, a Biomeridian machine? What is that?
Yeah, the Biomeridian machine is a little more testing and diagnostic based. But some of them do offer a similar idea of figure out what's going on and then input the inverse frequencies back in as a treatment modality. But in my experience, Biomeridian is a little more diagnostic versus treatment oriented.
And they're both fairly older technologies. I think like Swiss German built machines I've seen that seem to go back to, I want to say at least the 1970s.
Yeah, 60s and 70s is when they really started to come through. And of course, they've had their evolutions and updates, but they stood the test of modern time. So which is impressive to me when people can so much go look on the internet and see what is and isn't working and fall by the wayside otherwise.
How about Acugraph?
Acugraph is a way, it's kind of similar to biomeridian testing, but it's a full body scan. So you can measure actually which acupuncture points are dysfunctional, which meridians need energized. So it's a great way for acupuncturists to do a full body scan without having to sit and do all the traditional Chinese medicine diagnostics.
I'm just asking you all these questions. Maybe I ought to take a few, but I got a good one here. A Chi machine. So this is one that, can I just pretend like I know more about it than you?
For sure, I would love to hear your side of the Chi machine.
So because we actually do use the Chi machine in our office. Dr. Schulman is who introduced me to the Chi machine, and it's a little device that kind of you lay down on your back and you elevate your ankles, and it sort of just wobbles your ankles laterally side to side. The results of it are really kind of interesting and impressive in terms of opening up chi and meridian and some of the bioenergetics. It can be quite powerful. I'm always fascinated with any device that the patient unequivocally feels a result for immediately or in real time, because that to me is a lot more powerful on their psychology, whereas some other things they may not really understand muscle testing or kinesiology, and they may not really understand another device that they don't feel an instant. It's almost different if you feel heat coming from a heating pad than if not. And the Chi machine
helps.
It's powerful. I guess I'll take neurofeedback. I think a lot of people are familiar with neurofeedback. It usually uses a computer, and it's monitoring your EEG in real time and through a series of programs and software, and then real-time feedback. You can train the brain into certain brain states, or even interrupt certain trauma encoding or other programs as they come out. We had a great show with Nicole Bacharach all on neurofeedback, so reference that as well if you want to know more about neurofeedback. Similar to neurofeedback's the BAUD device, which stands for Bioacoustical Utilization Device. I'm trying to see if I had that written down. I just always refer to it as BAUD. The inventor of BAUD's still alive, and interestingly, it's an acoustic way, almost like EMDR, which is not a device, it's a therapeutic modality, to interrupt some of the circuitry and programming, particularly as it pertains to trauma or other, pathological and maladaptive patterns.
Do you utilize those during like some forms of like therapeutic talking, like walking a patient through like a memory or anything like that, or do you just use them on their own?
So that's how the inventor of BAUD intended it to be, is to be used in real time with the clinician, which is an expansion of our larger synchronized synergistic therapeutic model and that whole emotional shifting process. But what's interesting is some people it's almost too powerful. So it can open a Pandora's box. It can open a trauma. Very rarely. Now the inventor won't tell you that, or I haven't ever heard him comment on that, but I have seen that clinically, and to me that speaks to the power of it in terms of using caution to scratch at a trauma or a wound and opening Pandora's box. You might be, because it's mainly using acoustical inputs to target or interrupt a certain brain state, and sometimes that includes reactivation of that what you're thinking about. So that's always something to be aware of and cautious. Here's one of my new.
So I wanted to hear about your torch. What have you been using lately on that front?
Are you reading my notes? Are you cheating? So the torch, I guess because that's built closer to me than you. That's a pretty cool infrared device that has a series of wavelengths that can be used. It's got a little probe to go right under your tongue, which all it's accessing here is a vascular bed. They do have an intranasal for people with a lot of mold and sinus issues. However, really you're targeting vascularization. I've still waiting for them to come out with the poop chute version. But the point is, you're basically transvascular bed as opposed to IV or IM or transdermal, accessing blood and introducing this targeted EMF therapy directly to the vasculature, and that can really help detoxify, help with mast cell stabilization, antihistamine, a lot of immune complexes, oxidative free radicals, and it's kind of like, almost reminds me of UV therapy, where that you might take blood out of the body and run through a device or machine, which I guess that's our next device too, right? A UVB machine. Do you use one in your practice?
We don't use one. Sometimes I'll refer out for it if a patient's just that, like running that high of an infectious load, then I'll refer them out for some ultraviolet. But tell me how you use it. Tell me what you're mostly seeing with it.
I'm surprised. Did they use that at the last joint you were working? Mm-mm. Okay. Because I see its power and utility is more in people that might have, mold in their blood or a lot of immune complexes, antibodies related to mold, other really free radicals, highly oxidative states. It has an antioxidant effect and a sterilization effect of the blood too. Antiviral, I would have loved to have seen that used during the pandemic, when all that they were doing is flipping people's bodies over in the hospital and transporting their lifeless corpse out when they expired. There was really not much of anything else they were doing in hospitals in terms of support. I would have loved to have seen IVC. I would have loved to see UVB, blood, ozone. It's just, the medical legal Western model and the timing and speed at which it hit our system, it was never done anywhere. It was never really entertained. It was just flip them on their stomach. So they, it buys us a day to transport their body out when they die. And so I think it has a lot of benefit for that antimicrobial and helping to reduce free radicals and a lot of these nasty toxins that can cruise around our bloodstream.
Oh, yeah. It's a good one. It's one the time I use it the most is if I'm going to have a patient do stem cell therapy. And so I'll have them do a couple rounds of it before stem cells, just so they're clean before you introduce all those fresh stem cells in there.
Yeah, that's a cool application. What about, how does that similar or different from lasers? How are you using lasers? What's a laser? What does laser stand for?
Oh my gosh, thanks for the quiz, the biophysics quiz there on that one. So laser, I don't remember the exact acronym.
I'm just messing with you. I can't remember it either.
But it's essentially a highly coherent, focused form of light. You have cold or hot lasers, but typically in clinical offices, we're using cold lasers. And they basically stimulate your mitochondria for energy. They lower antioxidants, improve blood flow, highly, highly, highly anti-inflammatory. And so they're really great for wound healing, stimulating the brain, stimulating mitochondrial function, and just supporting. I'll just have people stick a laser over their liver, stick it over their heart, stick it over adrenal points, things like that, or especially broken down tissue and injuries.
And increasing blood flow to an area to speed healing as well, right?
Right, exactly. Yeah, they definitely, especially if they're in that 660 nanometer wavelength, they'll increase a lot of blood flow.
Here's another one, HRT, heart rate variability. What's that?
Yeah, so our HRV in our cells, when you measure it, it's a way to measure how the variations in our heart rate. And when we have a higher variation, we're more adaptable, we're more resilient to stress. Our autonomic nervous system's functioning better. Lower HRV would be when we're more stressed or not easily able to adapt. It's actually a really good way. A lot of athletes are using it now. Well, a lot of anybody's using it now, but because you can see, okay, if I'm doing an intense training program, like an Olympic athlete, and then on day 10 of this program, my HRV drops, you shouldn't train that day, right? It's a neat way to use it. And then you can use HRV training devices in order to increase that. So meditation's an easy way to do it, or probably even neurofeedback, but you can specifically use heart rate variability training devices to increase your stress resilience, lower and calm your nervous system. It's a neat setup.
How about VCS? Tell us about that.
Yeah, the VCS visual contrast sensitivity test. It's a really good mold or biotoxin screen. It's very quick online. It uses a visuals test, almost like the one you go take at the DMV. Very quick test like that, but it tells you, do I have neurotoxins? Do I have an eye issue? Do I have an autonomic nervous system issue? It's very affordable. It's easy for your doctor to interpret. And it's like, hey, if I think I got mold or Lyme brain, let's take this test and see.
To pick on that one a little bit more, I know we're trying to blister through them, but that one's unique to me because not just the accessibility and the affordability, all of that should be go into any consideration of any medical decision making. So that's great from that standpoint. But functionally, it's really cool test because a lot of people don't know that our eye is brain tissue.
Yes.
The optic nerve is part of the brain and the nervous system, et cetera. So you can learn a lot about brain and neurologic illnesses or whole body illnesses by looking at the eye, in the eye, and the performance of the eye. So what's neat about VCS is it's a low invasive, low cost functional analysis of kind of the final output of brain performance via the eye, sampling kind of the eye. So that one should be one of our favorites. We'll see if it comes up here at the end.
Yeah, if you're a neuro geek, it's a neat one.
The what?
If you're a neuro geek, if you love neuroscience, it's a pretty amazing test.
Yeah, and you can learn a tremendous amount from it. You contrast that to something like an MRI, which is amazing technology, and it's very high resolution, and it gives you great pictures of anatomy. The clinical utility of it is very relatively small compared to how powerful it is. This is almost the reverse.
Yeah, that's a good point.
I think is really, I make good points. That's what I do here.
Yeah.
I just had that written down. You probably told me that. What is well, okay, I'm quizzing you too much. We talked about the Chi device, but what do you know about SOT? That stands for supportive oligonucleotide therapy.
Yeah, the SOT is really great for chronic infections in the Lyme family, especially. And they do some other infections too, but essentially what it is they take a sample of blood, they run a quick test on it to see what bugs you have in there. And then
not in the United States, right? Your blood will be shipped to Germany or another.
Yeah, so they're not running the test here. It gets shipped to Germany, and then they make a specific treatment based on RNA, where the idea is that the treatment actually goes in, and when the bugs are trying to replicate, it binds to their RNA, so they can no longer replicate anymore. They're losing the signal, so they just naturally die out because it's actually like a population dying off because nobody's having any more kids. And so it's I've seen it in my patients at least. Well, I'll let you dive into it more, but it's an amazing technology as far as a treatment modality goes.
Yeah, and I think a lot of more people are interested in it as a primary treatment. Mm-hmm. We see a number of patients that, if you're talking about cancer, its application in cancers, they're saying, you know what, I don't want to do the chemo, radiation, surgery thing. I want to try this more, personalized silver bullet. And that to me makes its therapeutic potential really powerful. Not totally a device per se, but it's squeaked in on the list, so we'll let it slide.
I make up the story that they probably use a device to make the treatments.
Yes, I'm sure there's a device involved, like a mailbox to ship it to Germany. Here's a fun one: a flotation tank, an isolation tank. What's that?
Oh my gosh! So when we use them, it's basically it looks like an isolation pod where it goes into either dark or very low light, but it's full usually of something crazy like 1,500 pounds, I want to say, of Epsom salts in one tank. And so you float in the tank. The water is so buoyant with all that salt that you actually float in the tank. And then you can deprive your body of all this extra sensory input, this outer sensory input. So you can get a lot of times into some crazy meditative states. I would love to hear later your experience with float tanks and see what.
How do you know if that's going to be one of my favorite, Dr. Hart?
I have no idea, but I was going to ask you about it.
Oh, okay. What is Hemisync? Hemisync. That's another fun one. Maybe I'll
let you talk about Hemisync.
Oh, you let me talk about Hemisync. So Hemisync, we were trying to figure out if that actually came out of the LaBerge Institute. I was really always interested in brain states, binaural beats. Hemisync was a therapeutic modality early on, I think developed in the 80s or 80s, I'm going to say, for a lot of different reasons. But it was similar to the bioacoustical utilization device, the BAUD device, in that it uses pulsed waves in a way to entrain the brain to either favor left brain, right brain, simultaneous across the corpus callosum, and to help retrain the brain, almost like neurofeedback would, through acoustic input. And a lot of people use it for a lot of different reasons, whether that's to turn the knob down on a trauma in real time, similar to a BAUD device, whether that's to explore creativity or to target certain brain waves in a certain region of the brain. And it has a lot of years of kind of evidence in terms of its benefits on not just brain states, brain health, brain training, but also creativity. And a lot of times, almost like yoga or meditation, can help lower blood pressure and have a number of other physiologic outputs. So that's a pretty neat one as well. We didn't talk too much about crystals. How do you use crystals as devices? And when I mean crystals, I don't mean piezoelectric, because we all know what that is.
Yeah. So I don't use them individually like a crystal healer might, but I use them in the devices. So like inside of biomats, there'll be a layer of different like amethyst or different like quartz crystals, in order to both, they can carry the signal of whatever the mat, like the pulsed EMF signal, but also each different type of crystal has its own effects. Like a quartz crystal kind of traditionally is very good at absorbing and dispersing energy, right? So you can use quartz for somewhere that's an overactive spot in the body, use it to drain that. You can use different, like rose quartz is a major balancing. So when somebody's energy is kind of scattered, like somebody's got major anxiety or trauma, quartz crystal is a great one to bring that in. But you can use them in different devices, such as the saunas. Some of the infrared saunas we use actually contain a layer of crystals in the barrier to create a massive field, so that patient's not only getting an infrared sauna effect, the detox effect, but they're also getting an energetic balancing effect.
We could do a whole show just on crystals, because they're, like you're talking about, whether you use selenite for auric sweeping, or you're talking about the quartz crystal that's, in every single one of our smartphones or devices and has like piezoelectric effects and stuff like that. They are a therapeutic device, and I think an important one that are often overlooked. You led the way into the grounding mat. What is a grounding mat?
Well, yeah. So typically, way back when, we'd walk barefoot everywhere, and the earth would absorb, it would ground literally our extra dispersed electromagnetic fields that we have in our body, which is typical. But now we've got tennis shoes, we're on top of concrete and subfloors. Many of us are sometimes 2-3 stories up for most of the day off the ground. And so our body's not discharging all that extra electromagnetic energy we're making naturally. Heaven forbid all the stuff we're taking in from cell phones and Wi-Fi and computers,
and generated within our own brain, right?
Yes. Yeah. So your brain and heart is a fun fact. The brain makes a really strong EMF field. The heart one makes one that's about 10 times or even bigger, maybe, of that same field. And so we're generating a ton of good EMF, but a ton of EMF regardless. And so a grounding mat connects into an outlet that's grounded, and then you can stand, sit, attach it to a wrist or ankle, and disperse that extra EMF field that we're making and absorbing. And so for me, that's less pain, less joy. I stand on one all day when I'm treating patients, and my energy is better throughout the day. I'm not so tanked after doing energy medicine all day long. I've got a better balance on that front.
So it's like absorbing chi static.
Yeah, that's a really good way to put it. Yep.
Thanks.
All the excess static coming off.
I'll be here all week.
That's right.
No, the other thing they do is a lot of times they warm the crystals, because most people don't realize that crystals measurably behave differently as a function of temperature and pressure. which is kind of it's a basic actually physics principle, but it seems very exotic, but that's basic piezoelectrics. And the grounding mats, I think, are really beneficial. It's one of those things that people actually feel within one treatment, like,
oh yeah,
this is markedly different.
Well, we'll have to do a show on this topic at some point, but to kind of jump off that same point is, every one of our cells is technically, by a biophysics standpoint, a liquid crystal. And so, we're made up from head to toe of a liquid crystalline matrix inside out. So we are constantly, every poke and pressure is a piezoelectric effect and a temperature effect, which is why we have a certain temperature we need to stay at. And if we're outside of that too much, it's disruptive, and why we need a certain amount of pressure and touch and connection. And so we'll have to do a show on that at some point.
Deal. I'll put you on the schedule.
That's right.
This isn't really a device, but I kind of lumped it in there. We talked about colon hydrotherapy. That's something that I think has a lot of attention. A lot of people are doing, and technically it is a device. You get this thing up your poop chute, and it's irrigating, and a lot of times has that actual clear window, right? So you could watch what's coming out, we'll just say, and it's backlit. It's not reinfused back into the body or anything. It's different from something like a coffee enema per se. But the colon hydrotherapy machine, how is that different as a device? How is that useful? Why are we looking at what's coming out?
Well, what's incredible is you can see, the colon's not that long, right? And that's really where it's getting flushed out with colon hydrotherapy. And so, but you might be on there from anywhere from 30 minutes to 90 minutes on that table. And you see, you're really, the colon's really cleaned out, as far as fecal matter and poop goes, within 10 minutes, 20 minutes. And so what's neat is to see coming out is you can see, okay, we're going to do some massage in the sinuses. Oh my gosh, look at that orange stuff coming out in direct relation to doing sinus release on it. Or like, let's do a little extra liver work, and all of a sudden these black flakes start coming out that were probably bile material that was caked inside that bile duct. And so to see really what's coming out, the favorite is to see when a nice worm comes out. You got a parasite that's floating to that tank. It's, number one, you're getting it out, better out than in. But two, the patient can say like, wow, okay, that's, they feel good about what they're doing, but also recognizing how true it was that they really were dealing with a major parasite issue.
Yeah, so you can see macroscopic things. I mean, you can't see microscopic, but in addition to parasites, you can see biofilms and fungal units. And for them to be that large is actually quite impressive and amazing. And it shows you how loaded up your body was with this toxin. And then we understand how the toxicokinetics and how that pollutes and affects our body and then our body's response to it, or worse, autoimmune disease, right? That's what we see every day. What about pulsed EMF? Is that a device? What's that?
Yeah, so lots of different devices. Pulsed EMF, though, is basically, it's a way to use the electromagnetic field, which is technically present all throughout the universe, but it uses impulses to create different effects. So you can, for instance, use it to pump out Schumann's resonance, which is the resonant field the Earth pumps at. So that one's very good for similar effect of grounding, but you're not grounding. You're getting, instead of input or taking things out of you, it's what the Earth is outputting. And so you're getting that effect. And so the PEMF field is great for everything from, improving circulation, like a BEMER mat, which is a pulsed EMF field, all the way to like devices that are more meant for contraction, lymphatic drainage, and injury tissue, so lowering inflammation, things like that. So those PEMF fields are huge. I think even who's the big guru, Tony Robbins, in his latest health book, he talked a lot about PEMF beds and how he uses one on a regular basis for keeping his cells young, rejuvenating them.
Well, you brought up the BEMER. Somehow that slipped off this list, and that should not have been, because the BEMER is something that we both use. I mean,
how have you been using it lately? What do you think?
I pretty much use it on everything, because it's one of those that a lot of times people don't immediately feel that instant result that we were talking about. It's kind of, not to pick on chiropractics, but sometimes realigning our skeletal system or the musculature or the vasculature or the nervous system that goes along with it can't be done in one single session. So it's got more of an accumulative effect. So a lot of times we'll use it underneath somebody, or at the same time that they might be spending an hour in the infusion room and getting an IV, or we might use it when they're doing sacred geometry acupuncture, or have it under their mat during a massage therapy, similar to like the amethyst bed.
I think the idea of especially using it with the IV is really neat, just because of how much it increases that not only increases macro circulation, like the big arteries and veins, but the micro circulation increase with the BEMER is huge, like 27% jump rate, which is massive as far as circulation goes. And so you're really, for those people, probably driving those nutrients so deep and getting such a better absorption rate while using the BEMER. I really like that idea.
I forgot if we covered hyperbarics.
I don't think we talked about it yet. No.
So the BEMER made me think of hyperbarics, because we're talking about penetrating, whether that's temperature, oxygen, pressure, barometric pressure, or mechanical pressure. How is that different than a hyperbaric chamber? And what is that thing anyway?
Yeah, so hyperbaric oxygen chamber, hyperbaric oxygen therapy is when, so you're in a tank, either a soft shell or hard shell, and what they do is they increase the pressure. They call it atmospheric pressure. They're increasing the pressure in there, like as if you were going in a submarine. So the pressure around you is building, and then you're inputting highly concentrated oxygen. And so that pressure is forcing the oxygen very deep into your cells and tissues. So hyperbaric is just, it's great. Well, medically, we usually use it for tissue healing, right? Wounds that won't heal, fractures that won't heal, but you can use it almost like the different movies use different tanks to speed things up. So you can use it to speed healing, to heal tissues that don't usually get oxygenated well, especially the brain tissue, things like that. That's a biggie. That one's quite impressive in its capabilities.
So, and that's very common Western medicine, traditionally just treating the bends or other things as a way to control pressure differentials, and but they could also increase oxygen content in that closed room, which increases oxygenation to the tissues. It almost reminds me of like a wound vac, or if you put water on a sponge, it's going to absorb, but if you put water on a sponge in a vacuum, it's going to absorb faster.
Yes.
Oh, good. I accept your apology.
Yeah, I'm sure you get in wonderful arguments with your wife. I'm sure those go great.
No, I don't engage. That's no. She's always right.
Yeah.
You know this. Come on.
Mm-hmm.
What about a salt room? What is a salt room, and how is that a device? And is that a real thing? How does that help people?
It is. Legend has it that it is real in some parts of the universe. But a salt room typically is, called a lot of times a salt cave, because they fill it with Himalayan salt typically. And so what that does is it creates a drying effect, but it's very good for the sinuses and lungs. So that salt is putting off a massive amount of negative ions, right? So when you're by a body of open water or out in the woods or out in the jungle, all those green plants and all the open bodies of water are putting off a ton of negative ions. So it's a bunch of antioxidants, electrons that our body is soaking up and taking in and using to make energy, to clean up free radicals, clean up our cellular metabolism. And so that salt room puts off a bunch of those negative ions, but also it can dry out and clean out the lungs and sinuses. Great if you got congestion or a cold, any of that sort of stuff.
And salt rooms are very popular right now. There seem to be popping up everywhere, like infusion rooms. So that, again, in terms of going someplace one time, one treatment, and convincing people who may be new to the field or even somewhat skeptical, they want to believe, but there's part of them. I think devices like that are better to start with than some that people don't see a benefit from one treatment or one intervention. And certainly almost like a neti pod or a nebulizer, nebulizing vitamin C or silver or something like that. It's until you've done that, you really don't realize that power for you personally. Of course, all of this should be done by in coordination with your provider, and tailor making your treatment. But it's a really cool, accessible, available device. How about we talked a little bit about the Scenar device. Scenar device from what I understood, was invented in Russia, and it was primarily used as a way to attenuate pain or to increase, like we were talking about, blood flow, and which will then decrease inflammation, and then as downstream decrease pain, etc. That's not one that either one of us is currently using in practice, but it's one that a lot of people, I have people actually ask me about it from time to time. So it's good to kind of bring up and mention here. You can kind of do a quick online search and really educate yourself about that as well in terms of where it's available, what its applications are.
Yeah.
Do you got anything more on Scenar?
I don't think so. Nope.
Here's one of my favorites, although technically it's not going to be one of my final favorites, but the Nova Dreamer. That was a device that, again, I think came out of the LaBerge Institute, the same folks that did the Hemisync, which essentially is like a sleep mask, and you wear it when you sleep. The difference is it has some electronics up here that's looking for rapid eye movement. And when you're in REM sleep, when you're dreaming, it tells the device to flash a signal which goes through your sleeping eyelids. And if you are in a dream, it will signal you're in REM sleep, and it allows people to wake up or participate in transmute into a lucid dream.
That's so cool.
So it's like, I guess it's a lucid dream training tool. It's a pretty powerful one. There's a lot of other supportive things that they can do along with it, but they're technically not devices that they got chopped from our list. And I'm sure there's a lot of other devices that we don't have time for, but man, we got through a lot of them.
We did.
What are your favorites? Like, if we could pick 3 favorites, what are your 3 favorites and why? No one ever asks our favorites. That's fun to talk about.
Yeah, I really love the CRT machine. So the computer regulated thermography, the ability, number one, for a total body scan like that. That's what everybody likes from the idea of the movies. There's just some way to do a total body scan. Well, the CRT does offer that capability for me to say, okay, what are the general organ systems functioning at? Where are they stuck? So something I see quite often, it takes maybe half an hour to run. You know, you train a tech to do it. We've got Jennifer who does our CRTs for us. And so it gives you, like, for instance, what are the sinuses, the ethmoid, the maxillary, the frontal sinus, what are they doing and how are they responding? I find so many subclinical but long-term sinus infections with the CRT machine that once we start treating them, people get massive improvements. They say, I don't have a sinus infection. I say, well, you do, according to the machine. And when we start treating it, they're noticing, okay, my energy is getting better. My general immune system's better. My eyes are doing better. My head's functioning better. All from treating the sinus infection that nobody else would have found had they not done that. Or, for instance, it was actually introduced to America in the 70s as a way to do breast cancer screening. Okay, because it's got a breast setting you can measure on, and so it can actually predict potential breast cancer issues 5 to 7 years before a mammogram can. Okay, and so I actually had a case recently within this last year who, for 2 years, it was coming up as a potential breast tumor, but mammograms kept being negative until it wasn't one day. And so we were starting to work with it, but I couldn't get her medical team. I don't treat cancer, so I couldn't get her medical team quite on board with what I was trying to get them to do with her. But she's doing much better now. She's cancer free now at this point. But it's incredible in its diagnostic. Now, we don't use it as much in the US for that, because in the 70s you had to use it's computer generated, right? Computer regulated thermography. So you had to shut down the hospital's computers, switch it to the CRT machine, and then upload it back. And at that time it was like, hospitals were like, that's pointless. That's too big an issue. Yeah, now you can hook it up to a tablet and it's no big deal. So it's incredible. I love it for early breast tissue detection, total body stuff, sinuses, and teeth. I find so many infections in the teeth with that dentists end up confirming later. So that one's a really good one. Why don't you give me one of your top ones?
Oh, my turn? All right. Yeah. I think SOT is one of my favorites, because there are a lot of treatments, not only just in this country, but in this world, that I'm quite frankly really surprised that Western medicine either hasn't caught on to yet or doesn't have enough evidence basis for. And so the whole bench to bedside window takes about 20 years. And to me, I feel like SOT's caught up in that land. And, we were talking before about sending blood off to Germany. Germany is not a third world country. This is a very, very advanced first world, arguably in a lot of cases, better health system than even our own. So this isn't, backwoods medicine or anything. And I love the idea of tailor making personalized treatments for everyone's personalized physiology, not just their biochemistry and their genetics and all that, but their physiologic state at the time of illness, because your body changes underneath you. My body 10 years ago is not my body 10 years from now. So it takes that personalized approach to a personalized problem at the personalized time, and really gets really good results. I've heard a lot of and seen a lot of really good outcomes from it. So me, that's like probably one of my most favorite in terms of being excited about it and its potential for the future.
Yeah, I think it's applications from the applications I've seen primarily working about Lyme patients is in the Lyme world. Does it have some, you were talking, I think a little bit, does it have some cancer applications you're using?
Yeah, 100%. Yeah, and it's the application and design is probably very similar, specific to Lyme itself.
Mm-hmm. Yeah, that makes a lot of sense. That's exciting.
Yeah, so they're targeting the actual cancer cells, because if you have cancer cells in your blood,
right.
Ostensibly, depending on the status and the stage of it. But they analyze the blood and they analyze specifically mechanisms to target that particular tumor. Again, its signature and, more importantly, its response to those types of treatments and interventions. It's really not unlike what they do with culture and sensitivity for antibiotics and a UTI.
Yeah,
it's a little bit more complex to explain, but it's the same principle.
Yeah, it makes me sad it's not getting picked up yet, because I've really seen great things with it.
What's your, give me another favorite.
So we talked a little about the hyperbaric, but that's definitely a biggie for me, because of the way, two big ones for me that make a huge difference is with the hyperbaric is its ability to increase tissue healing, right? And mitochondrial health, because it's driving oxygen through that cellular respiration to our energy powerhouses of our cells. And so a lot of people with mitochondrial dysfunction and like chronic fatigue, when they're in the hyperbaric, what they're telling me is like, that's the only time I feel normal. Because I think their cells and mitochondria actually functioning close to optimum with all the extra oxygen, but also brain healing and deep infections, especially when they're in their central nervous system, right? So when somebody has an infection like neuroborreliosis, which is neuro-Lyme or Lyme disease in the brain, the problem is most herbs and even drugs don't cross the blood-brain barrier, right? And so how are you going to deal with that infection? And even if you can adequately deal with that infection, how do you get it out of the brain? Because the only way you can detox that is at nighttime when you're in deep sleep with that lymphatic system. So the hyperbaric kind of hits twofold, where it'll help improve detoxification, especially while somebody is laying down. It can improve that cerebral spinal fluid flow, but then also it gets that oxygenation deep in there. And any of those bugs that are anaerobic or can't deal with a high oxygen environment, it's going to create an antimicrobial environment for them. So it's a fantastic way to do that. And then with those neurodegenerative cases, ALS, Parkinson's, Alzheimer's, we really need to oxygenate that tissue in the brain. And so I've seen improvements in all three of those with repeated bouts of hyperbaric oxygen therapy or bouts in the chamber. And so one route I'll even use it for myself is if I'm getting a cold sore. And usually once you've got the blister, you've got to ride it out. You've got to ride the pathway out. But I'll typically do a round in the hyperbaric, and that tissue healing speeds up so much that instead of being 7 to 10 days, it's usually 1 to 3.
It's sort of like it reminds me of like when you're sick, why the body mounts a fever. It's to make, the invader uncomfortable and have an inhospitable environment. And so, like, to your point, increasing the pressure, the saturation, oxygen content, you're able to reach deeper and make illness uncomfortable to exist in the body. I don't know. I'm a metaphor guy. They made me think of
Yeah.
that.
It's like when you start turning the lights out at your dinner party because you want your family to leave.
Okay, that's a good one too. I was telling, all right, my turn. Probably my next favorite is, can I pick 2 for 1? Give me 2 for 1 on this one. Because I'm going to lump neurofeedback and BAUD together. Sorry, Dick, I don't freak out. The reason why I think that's one of my favorites is because neurofeedback is one of those treatments that a lot of people have heard of. They think they know of. It's just, I don't really know what that is. I've never had that done to me. But if you actually go and you do it, I don't care who you are, it will change your physiology. It will change your brain state. No one ever goes, yeah, I don't feel nothing. It's very, very powerful. It's very quick. It's part of a lot of what we do has to do with changing our brain states. So it's a way that you can really help people drop into their body, focus in, and this is the most exciting part, utilize it during like trauma therapy sessions to not only access spaces, but modulate responses and facilitate integration and kind of the psycho device marriage, the therapy and then the technology device. I've always been sort of fascinated with that from a biomedical engineering background, sort of like transcranial magnetic stimulation, although that's not my favorite. I still get one more. What's your third? What's your third and favorite?
Yeah, so my third is the low level laser therapy, right? So the cold laser we talked about a bit earlier. And so the reason I like that one is because when you can apply that repeatedly, its ability to help generate, one of the things I didn't talk about is it actually stimulates your body's stem cells, right? And so it stimulates the stem cells in the different tissues. So you can put it on, like, for instance, the liver. And you can buy some pretty affordable ones to use. Like, so I have some patients purchase them at home for, less than a couple $100, which is, as far as a therapeutic device, is pretty affordable. And so you can do it on the liver, let's say daily. Or I've had diabetics do it on the pancreas region consistently, and eventually that will penetrate the skin deep enough that it's going to hit those organs and absorb some of those photons and start to repair and clean itself up. And I've seen those tissues take on new effects. So a pancreas, like a type 1 diabetic, might not become fully normal again, but suddenly those islet cells are starting to produce a little bit of pancreas or insulin that it wasn't before. They need less insulin, and they're a little more metabolically flexible with sugars. Or on a old injury, scar tissue, arthritic knees that have been arthritic for 20 years, you do consistent laser therapy on it, and that tissue starts to rejuvenate, got fresh blood flow now, the mitochondria are starting to turn on, the stem cells are starting to turn on, the inflammation's going down. You can really make a big difference there on different joints. And that maybe you couldn't, I've got one case where they want to replace both of his knees. And one of the ways we've been able to keep him away from that, because the reality is it's not a fix. They make it seem like they're changing the tires on your car, going to be brand new, but it's not. For most of those people, changing a hip, getting a new knees is not that much better than where they were at before. And so he doing consistent laser therapy, he's been able to stay away from having his knees replaced. And he's just as limber, just as flexible, even more so than when I first started treating him, now that he's doing laser therapy on them. And so, the guy's in his late 50s and he beats himself up. If he's listening to this, you are, but the laser therapy keeps him going.
It's hard to improve on Mother Nature's design. I think that's something when I approach medicine, I really have a lot of respect and a lot of awe at our design. And I think there's a lot of arrogance in medicine to presume that we know better, or somehow in the last couple 100 years, 1,000 years, 10,000 years, we've been able to walk upright. We can somehow, like you said, just replace a part, like it's like we're upgrading a design of a car or a machine or something like that. And having people understand that, whether that's spinal surgery, knee replacement, hip replacement, is really important. And I can tell you personally, for my wife, there was a hip pain issue that could not be corrected any other way. She absolutely felt that relief from the K laser or the cold laser, which is really amazing because it's a very deep joint. I wish we could laser through our skulls.
Yeah. Well, so I do a lot of brain lasering. And there's certain, you talk about the getting torch up the nose, and there's some different lights you can stick up there to hit the capillary bed. Underneath the EOP, there's a tiny gap that actually connects there that we can do quite a bit of photon absorption. But the general idea is, you hit any of those capillary beds that are close, and eventually, if you do it often enough, you what they call the joules, you crank the energy up often enough over a period of time, the photon absorption is going to be quite dense. And so you can get some of that to the brain. And so I will have patients stick it under the nose to get through that region there, right between the eyes, back of the head, and sometimes the different neck regions, and sometimes in the temples where we got a lot of blood flow, although not all of that's getting to the brain. But it's increasing how much photon penetration can you get and get close to that blood that goes to the brain, because the photons will flow through the blood and travel to those areas. So
was that 3? You got 3? Do I got one more?
You definitely. I don't want to leave you out. You're too generous.
What do you think? I'm gonna go with Flotation Tank. Mostly out of nostalgia and timing. I kind of feel like it's hard for people to learn how to meditate their first time. It's almost easier to have guided meditation either by a hypnotherapist or listening to a tape or YouTube or something like that. It's an important time that people learn how to quiet their mind and still their mind and poke within and discover, what am I? Who am I? What thoughts, feelings, emotions do I have when I look under the busy brainwave of day-to-day life? And to me, the flotation tank's a really interesting tool. Plus, it reminds me of William Hurt and Altered States. It has a nostalgia there. I think it has an application that's like you were saying before, in sensory deprivation, almost like a deep meditation, but there's a tactile component to it too, like floating in the Dead Sea. There's a certain awareness. I mean, we don't echolocate quite like a bat, but there's a certain awareness that I think almost regresses you to the intrauterine environment. And that's very safe, healing, grounded, imaginative place. And when you can turn inward, tune in, drop out, it's really quite powerful. And like in the movie, it can be quite psychedelic. A lot of people have very powerful, transpersonal experiences in there. I think that's less common, but with training and with time in the tank and experience and sort of that fearlessness, I think that people are afraid to look within, and they're just reacting to their environments, and things happen to them. They're not aware of their power of creation and their power of control of their emotions and mind, and not take that passive victim role. It's very empowering from it is psychically inside.
It definitely gives you when you're in there and you can kind of get calm, and I think it really enhances their inner ability to choose, but also inner ability to create different states and create what they're wanting to in that landscape.
Yeah, it reminds me of the movie Inception. There can be quite a vivid dreamscape, similar to a cross between meditation and lucid dreaming itself. The timelessness is very powerful. Everyone knows waiting at the dentist's office, time moves slower there than in any other place in the universe. Or doing a really fun activity or having a great conversation or doing an awesome podcast when you're like, holy crap, look how much time's gone by.
Yes. No, I love it. If I don't know, you'd have to tell me if we have time, but I'd love to hear about some of your experiences in a tank.
We're out of time this week.
Sounds good.
Let's do this again. This is fun. I learned a lot.
Me too. Yeah, I love hearing about your travels in the dream world and your thoughts on the float tank, and yeah, I'm loving it.
Yeah, you just think of me as Leonardo DiCaprio. I get that a lot.
I thought so. I was thinking that.
Well, I'm a cross between that and Ryan Gosling, let's be honest.
It's true. You're quite handsome.
Not being honest. Well, then let's do this again next time. I look forward to our next topic and content. We're gonna promote that, so we'll leave people in suspense right now. Tune in next time. And remember to stay out of the newspapers.
Thank you, everyone.
Thank you. Be well. Until then.
Be well.
Yeah, that's what I'm talking about.